Welcome to Pulse and Pressors, where critical care gets crystal clear. Among all sedatives in critical care, none is as instantly recognizable as Propofol, the milk of amnesia. Smooth, rapid, and precise, it's the drug that can silence consciousness within seconds, a cornerstone of modern anesthesia and ICU sedation. Propofol is an intravenous general anesthetic of the alkylphenol class, formulated in a 10% lipid emulsion of soybean oil, glycerol, and egg lecithin, the reason for its milky appearance. This lipid base allows rapid diffusion across the blood-brain barrier, producing its swift onset and short duration. Each milliliter of 1% propofol provides approximately 1.1 kilocalories, a lipid load that must be included in the patient's daily nutritional plan, especially if they're receiving TPN or enteral feeds. Because this lipid medium supports bacterial growth, meticulous aseptic handling is essential. Vials and tubing must be discarded within 6 or 12 hours after spiking, depending on local protocol. Propofol enhances GABA-A receptor activity, increasing chloride influx into neurons. This hyperpolarizes the membrane and decreases excitability, creating global central nervous system depression. The result? Calm, controlled hypnosis, and smooth recovery due to rapid redistribution. Propofol acts in under a minute, a hallmark of its rapid brain penetration. A single bolus lasts about 5 to 10 minutes because the drug quickly redistributes from the brain into muscle and fat. This redistribution explains the fast wake-up seen after short exposures. Once redistributed, propofol is metabolized primarily in the liver through rapid conjugation, a process mediated by the CYP2B6 enzyme, forming inactive, water-soluble metabolites. These are then swiftly excreted by the kidneys. Occasionally, these metabolites can give urine a striking green hue. Propofol-induced green urine is benign, caused by phenolic metabolites, and resolves once the infusion is stopped. It's harmless, not a sign of renal or hepatic injury. This combination of rapid redistribution and high hepatic clearance makes propofol one of the most precisely titratable intravenous anesthetics, even in patients with mild to moderate hepatic or renal impairment. Its pharmacokinetic profile is the foundation of its clean, predictable sedation. In critical care, propofol is used for ventilator sedation, procedural comfort, neuroprotection, and rapid awakening protocols. It allows reliable titration and clean emergence, essential for neurologic reassessments, post-CABG recovery, and neurocritical care. In rapid sequence induction, propofol offers smooth, rapid hypnosis and antiemetic effects. It does not provide analgesia and should be paired with an opioid or adjunct like ketamine for noxious procedures. In hypotensive or volume-depleted patients, use reduced doses. Its vasodilatory and myocardial depressive effects can rapidly lower MAP. Propofol reduces preload, afterload, and contractility through systemic vasodilation and mild myocardial depression. A 10 to 30% drop in mean arterial pressure is common, and in critically ill patients, initiating propofol often necessitates starting or up-titrating a vasopressor, typically norepinephrine, to maintain target MAP. Optimize intravascular volume before induction and titrate slowly in fragile hemodynamics. Propofol depresses ventilatory drive, causing dose-dependent hypoventilation or apnea, especially with bolus dosing. Neurologically, it decreases cerebral blood flow, cerebral metabolic rate, and intracranial pressure, an advantage in neurocritical care and status epilepticus management. Primary indications include sedation of mechanically ventilated ICU patients, induction and maintenance of general anesthesia, procedural sedation, control of refractory status epilepticus, reduction of elevated intracranial pressure. Contraindications include allergy to egg or soy components, severe hemodynamic instability, and disorders of fat metabolism. Because its lipid base can support bacterial growth, propofol requires strict aseptic technique. Tubing and vials must be discarded after 6 to 12 hours to prevent infection or sepsis. Propofol infusion syndrome is rare but lethal. It results from mitochondrial dysfunction and impaired fatty acid oxidation. Clinical hallmarks include metabolic acidosis, rhabdomyolysis, cardiac failure, and renal injury. Risk increases with doses above 4 mg per kilogram per hour for more than 48 hours, especially in patients receiving vasopressors or corticosteroids. For ICU sedation, infusion rates range from 5 to 50 micrograms per kilogram per minute, titrated to a RASS target of -2 to 0. For procedural sedation, boluses of 0.5 to 1 milligram per kilogram are administered slowly over 1 to 5 minutes. For general anesthesia induction, doses are significantly higher, 1.5 to 2.5 milligrams per kilogram intravenous push, roughly 10 times the procedural dose, and responsible for the most profound MAP drops seen with this agent. Propofol provides a clean emergence profile, reduces postoperative nausea, lowers intracranial pressure, and enables rapid titration. Its pharmacokinetics allow smooth transitions between light and deep sedation, making it a mainstay in both ICU and OR practice. Remember, propofol provides hypnosis, not analgesia. Combine it with an opioid or adjunct when pain control is needed. Long-term use can elevate triglycerides and contribute caloric load. Each milliliter delivers 1.1 kilocalories. Hypotension is common and often requires starting or escalating vasopressors, such as norepinephrine, to maintain MAP. Compared to benzodiazepines, propofol enables faster awakening and less delirium. Compared to dexmedetomidine, it provides deeper sedation but greater cardiovascular depression. Choose your sedative based on hemodynamic status, sedation depth, and neurologic monitoring goals. Propofol defines precision sedation, rapid on, rapid off, with unmatched control. It remains the benchmark for anesthetic induction and ICU sedation, but demands respect for its lipid load, infection potential, and hemodynamic effects. When used judiciously, it balances calm with clarity, the essence of critical care precision. This is Pulse and Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.